You're listening to the Doctors In podcast from martinclinic.com. Although we share a lot of practical and, in our opinion, awesome information, what you hear on this podcast is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes. So enjoy. Hello, I'm Dr. Martin Jr.
I'm Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 157. Today we want to talk a little bit about statins, cholesterol, and heart disease. We've been getting a lot of questions about this again, so I figured we would talk about that. Now, what's interesting is there was a paper written it was an editorial done in the American Medical Association Journal, so the Journal of the American Medical Association, and the name of the editorial was called Statins, which are cholesterol-lowering drugs for primary prevention. And the subheading is, the debate is intense, but the data are weak, right? And basically what they found is this. For every 100 people who take statins for 5 years, all right, so you get 100 people, for every 100 people who take statin for 5 years, this is what they've boiled it down to. 2 people will avoid a myocardial infarction. So 2 people out of 100 will avoid it. 98 get no benefit whatsoever. It has zero effect on mortality. So there's no benefit to mortality, which at the end of the day, that's what it's supposed to be doing, right? It's supposed to keep you living longer. And anywhere between 5 and 20 out of the 100 will experience symptoms, some significant symptoms, muscle aches, fatigue, decline in cognition, increased risk of diabetes. So, I mean, again, the drug doesn't do anything to increase mortality. And a majority of the people absolutely won't get any benefit whatsoever. But yet, it's the first line of defense they just lowered again. What I find interesting is this. They got together not long ago and kind of redid the guidelines to physicians on when they should be prescribing statins. And the way that they did it, pretty much every adult needs to be on statins, right? It's just insane. Yet the data does not back that up.
Yeah. When they really look at it, right, the research is not showing.
It's not showing.
Yeah.
And like we mentioned on the last episode, you would think with the amount of people on statin drugs that you would have seen a correlation, at least, a decrease at least, in the number of cardiac events or cardiovascular disease. And it hasn't. Yeah. It's not like we've seen a significant reduction in any of those things, right? So again, even just based on correlation, it doesn't seem to have a correlated effect at all in any way, right? So I find that interesting. And here's the thing. This is another paper that was done. This is another study, and I find this one interesting as well. So basically, the conclusion of the study was that there's no evidence that high levels of total cholesterol or so-called bad cholesterol cause heart disease. And this was a paper done by 17 international physicians, so from all around the world, and they base it on a review of patient data of over 1.3 million people. And they're saying cholesterol does not.
You mean it's not the boogeyman?
Yeah, it's not the boogeyman. It's not what they've pinned. Cholesterol, it was a patsy. I mean, it literally was framed. Poor cholesterol. I mean, they were railroaded. It was a kangaroo court. Cholesterol was railroaded. Yeah. They came along. They had to find, they had to pin it on somebody, right? Because people wanted answers. Why are people dying of heart disease more and more? They needed a victim, and they found one, cholesterol. And the cholesterol didn't have a good lawyer or something. And then next thing you know, everybody was talking about cholesterol like it's the worst thing. Foods.
Did you see that commercial in the States where the guy, it's a fireman, he comes down the pole.
I've seen that one.
Yeah,
yes.
He races down that pole. He almost falls out of the
I've seen that one.
Out of the second floor to come down that pole to yell, "I got my cholesterol down." Yeah. Well, so what?
Well, and the funny thing is that now you feel like shouting back at him. There was a voice in the background. You wish I would say, well, now your chances of dying younger have increased, and your chances of your brain being healthier have also decreased. So congratulations. But your cholesterol numbers are good.
Oh, yeah. You'll look good in the casket.
Yeah.
It's unbelievable how they have taken this and, made it into, like you say, kangaroo court, all this and that, cholesterol. And every day in the clinic, it's incredible. Like it's there because there's a big conversation because there's a lot of pressure put on people, right, to take.
I mean, it's scary, right? You're 40, 45, 50. You walk into your doctor's office, they do some blood tests, they come back and they say, your cholesterol's high. And
based on what, though? First of all.
Well, yeah, exactly. But they're saying that their cholesterol's high, and everybody knows somebody who had a heart attack or heart disease.
They don't want that.
No, who wants that, right? And so they're like, all right, what can I do? And they're like, well, I got just the thing. We've got to bring that cholesterol down. So then they bring your cholesterol down, and then they find out that, 70%, I think it is lately, of people that have a heart attack have normal cholesterol levels.
Yeah. Well, I had a lady in this morning, right?
70%. Is that what the number is, or am I just making that up?
No. It's I think it's about that.
Okay. For some reason, 70% popped in my head.
Well, think about what I know, guys. I know we're preaching to the choir here. People listening to us, but let me just tell you what cholesterol is. Like people, you can't live without cholesterol.
It's so important that your body doesn't trust you to eat enough of it, so it makes it for you.
Yeah, 85% is made in your liver. Like you can't live without cholesterol. You don't want to. Hey, I got my cholesterol down. Well, wait a minute. You got less FedEx trucks on the highway delivering your hormones, your cell membranes, all of your cell membranes, your brain.
Well, even for a guy, you need it for testosterone.
Yeah, it transports your testosterone.
Yeah, you need it for testosterone.
Heck? So when you get on a statin drug and you feel really unwell, right? Oh, yeah, and they're so scared of having a heart attack, and I don't blame them. I mean, they're not the doctor. They're not the physician. They scared the living life out of you. I get a lot of people, I didn't really want to take it. I said, well, what was your numbers? I don't even want to get into what were your triglyceride numbers, or because we talk about this. What's your insulin? We always talk about insulin. Give me those numbers. I'm much more interested in what your insulin is, what your triglycerides are.
Triglycerides is a better indication. But you're right. I mean, but they're still to this day, handing that stuff out like candy.
They'll look back in 20, 30 years from now, I'm convinced of it, that if somebody is just being objective and somehow the pharmaceutical industry is not the ones that if they weren't allowed to even sponsor the TV shows in the United States like they do, like I think they're going to look back and go, I can't believe we got duped on statin drugs like we did.
Well, those commercials are funny because, I mean, if the commercial's a minute, 20 seconds is talking about the drug, and 40 seconds is the side effects. Yeah. And it's so funny, right? And then they'll say at the end, for a complete list of side effects, see our ad in, and they'll put a magazine that nobody will buy. That's so to get the full list, right? Like, I mean, what they're talking about now is like the partial list. If you want a full list of side effects, go check out our ad in this magazine. I mean, it is a funny thing. It's funny when a drug company will market directly to the consumer, skipping over the doctors because they want the patients to come in and say,
ask your doctor. Are you kidding me? Why do you have to ask your doctor?
Well, it is funny. And
but your doctor should be telling you what, right?
Let's come at this just for a second from the other side here. There was a study done, and fascinating, where they took 200 people and they measured them for insulin resistance, all right? And what they did is they divided them into thirds based on results, the lowest third, middle third, and highest third based on insulin resistance. And what they did is they tracked them for 6 years. And then they wanted to see who got heart disease, who had strokes, who had cancer, who had hypertension, high blood pressure, and who had diabetes. All right? So for 6 years, they tracked them based solely on insulin resistance. And you know what they found? Not one person, not one, in the lowest third became ill with anything. They didn't get heart disease. They didn't have a stroke. They didn't have a cancer. They didn't have high blood pressure. They didn't have a diabetes. If that isn't crystal clear on what the cause of all those things are deep down, then I don't know what to tell you. I mean, to me... Yeah. If you are worried about heart disease, you want to get your insulin down to the lowest third, in a sense. You want your insulin low because next to somebody with high insulin, all things being equal, that person's going to be at a much higher risk for everything. Yeah. Now, listen, there are other factors. We're not saying that the only cause of heart disease is insulin resistance, but I would say well over 80% would be that long-standing high insulin, right? So, again, that study I found very fascinating in terms of looking at it from a lifestyle perspective. So insulin resistance is a massive cause of heart disease. It's a massive cause of stroke, high blood pressure. We get that questioned a lot. How can I naturally lower my blood pressure? Well, a magnesium, stuff like that. There are a lot of great things you can do for high blood pressure, but the ultimate cause, you want to bring your insulin down. Yeah. There's no question, right?
Yeah. It's part of metabolic syndrome.
Yeah, it is a symptom of metabolic syndrome. So, I mean, that's coming at it from that perspective. Now, there are other causes of heart disease. So we talked about a big one, the biggest cause. Let's talk quickly about a couple other causes as well, because you and I were talking at lunch about one of the greatest accelerators of inflammation in the body, which is cortisol. Yeah. And you and I were talking about if somebody was overhearing our conversation, they would think, man, these guys are boring. They would think, man, these guys are boring.
Well, a couple of guys moved.
Yeah, did you see that? I did see that.
They were sitting beside us. Yeah, and they said, oh, boy.
This is like, they're hoping eavesdropping on a better conversation. And, we're geeking out on cortisol and inflammation. So it was so funny.
But it's funny. We pick each other's brains because it sort of reinforces all the stuff that we look at all day long, right?
Well, they always said stress is hard on the heart, but now you're starting to understand more why that is. I mean, cortisol kills your sleep, brings up your inflammation, it weakens your immune system, kills your gut. I mean, you could see how there's so many factors on how. So if you add cortisol, it's like the worst combination. If you have high insulin and you throw cortisol in there, it's an accelerant. It's terrible. And in my opinion, it just accelerates the effect that insulin has. So high cortisol is a big cause as well for people when it comes to heart disease. Or it just.
I love your illustration of it being an accelerant, right? Like if you got a fire started, boy, oh boy, does it ever add fuel to that fire, right? So, and this is where I say it, in heart disease in men, and it's my pet theory, is that most men don't have trouble with cholesterol at all. Their biggest problem is cortisol. Because cortisol hits a woman differently than a man. Generally, this has been my experience with it. Women, when they have high levels of cortisol, they can't sleep.
No, and their hormones just get destroyed.
And it messes up their thyroid. We talked about that last week, I think, or a couple of weeks ago, I think, in one of our thyroid. We were talking about the link in women, cortisol to their thyroid. And men are just completely different. Because what cortisol does over a period of time sinks that testosterone. I believe that it creates such an acute, it's almost like an infection in the heart. And these guys, can have a massive heart attack. So stress, cortisol over a period of time for a man is much more dangerous than it is for a woman in a sense that in terms of cardio.
Yes.
I think women are more susceptible to cancer. Because I believe that it's the
effect it has on estrogen.
Yeah, the estrogen, thyroid's not working properly. Thyroid doesn't work properly. It doesn't. Where have all your thyroid hormones metabolized in your liver? Your estrogen takes off. Well, one is breast cancer, but heart men sudden. They've been under a lot of stress with cortisol over a period of time. Cortisol's gone up. It creates inflammation big time around the heart. And I believe that men, that's their biggest issue when it comes to, and statin, what does statins do for that? Statins do nothing for that.
No, and talking about statins really quickly again, so a guy needs cholesterol to make testosterone or to have healthy levels of testosterone. They get on a statin drug, and so a lot of men, one of their complaints when they're on a statin, they don't even know it's from that, they feel weak.
Yeah. Muscle.
Yeah, they just don't feel strong. They feel weak, right? And again, there's so many causes of that, but I mean, one of them is definitely the muscle effect of the statin drugs, but then also, I think that it can affect their testosterone levels. And then you also need, and this is interesting, for your heart needs a normal testosterone levels in order to function properly. So a big cause of heart disease in men is chronically low levels of testosterone, which is interesting. So heart disease is very complex. There are some more common, like if you were to do the 80-20 rule, I would definitely recommend insulin resistance, keeping the insulin low. But there is a lot of different causes. So to blame it on cholesterol, like that's the cause, is idiotic.
Yeah.
I mean, it's done. It hasn't helped. How many people have we heard from that had so many side effects, and especially pain, right? They're muscle wasting. I mean, they don't get full rhabdomyolysis, which is just muscle wasting, but they get a lot of joint and muscle pain. It's incredible. So again, I guess just to summarize, if you want to keep your blood pressure normal and you want to reduce your risk of heart disease, keep your insulin low.
And that's food, guys. It's food.
Yeah. And
think about it.
So people would ask that question. Well, that's right. That has to do with how we eat. And
go on the serial killer.
Yeah, a lot
diet.
of crappy carbs people eat, right? High. Again, the worst combination that you can put together is when you combine a lot of fat and a lot of carbs, right? Especially if you make it a crappy fat.
You mean poutine?
Crappy carb, right? Which is high vegetable oils.
Yeah.
It's just
potato chips.
I
like the potato chips.
Well, a lot of people do. a lot of people do. And, you know, as you and I have talked about before, when they design the crunch of a potato chip, they do it for a very specific reason, right? So it is interesting. But, yeah, at the end of the day, if you are worried about your heart, if you're worried about cardiovascular disease, diet, specifically, keep your insulin down, strong muscles, strong heart, so exercise, and specifically weight training. Weight training is fantastic.
Because it lowers your insulin.
For your heart. That's right. It's fantastic.
It's the exercise that lowers insulin.
Well, we're out of time again.
Wow.
So we want to thank you for listening. If you have questions, you can easily get a hold of us. There's a lot of ways to do that. One of the ways is you can get a hold of us. Just email us at info@martinclinic.com, and we'd love to answer your questions. So again, thank you for listening, and have a great day.
Thanks for listening to the Doctor Is In podcast from martinclinic.com. If you have any questions, you can reach us at info@martinclinic.com. If you're not a newsletter subscriber, you can head to our website and sign up for free. We also have a private Facebook group that you can join. It's a community of awesome people. Finally, I do a Facebook Live every Thursday morning at 8:30. Join us again next week for a new episode.